Welcome back to another episode. I'm so excited to get this episode going, but before we get into the meat, I'd really appreciate if you could show us some love by following us on Spotify and leaving a 5-star rating. If you're watching on YouTube, hit that subscribe button and give this video a thumbs up. Let's say you've set a goal to lead a healthy lifestyle. Chances are the first few things you think of will be, okay, I need to exercise regularly, I need to improve my diet, maybe cut down on my oil, sugar, and salt. Maybe some of us might incorporate mindful practices, but the truth is, very few of us will consider sleep as a crucial part of the program. Now, I used to be one of those people who can sleep anywhere. Maybe because of the nature of my job, I always didn't get enough sleep, so I'm always tired. When I was a pregnant mom or when my children were very young, I also remembered being tired all the time and I slept at odd hours. I've never considered myself to have a sleeping problem, mainly because I've never had trouble falling asleep. And I don't think I snore unless I sleep face up. Now, I'm wondering as well, how many of you pride yourselves as workaholics? You believe that sleep is a complete waste of time. I'm totally guilty of that. I thrived, or so I thought, on 4 or 5 hours of sleep. And I would say things like, okay, I'm most productive at night. I'm inspired during that time of the day. And it's the only me time I've got, so I got to make the best use of it. I know I'm not alone. Sleep is the last thing we prioritize on any regular day. But are Singaporeans sleeping enough? And when there's no reason to be concerned about sleep because we don't have an immediate problem, are we taking it for granted? Are there health issues we can avoid by building good sleep habits? What do we actually know about sleep? From snoring husbands to the debate on whether children should take naps or not, and the unknown risks of not sleeping well or enough, there is so much I want to learn because I want to live a long and healthy life, and I wish the same for my family. So today, to help me unpack this topic, I have with me Dr. Kenny Pang, a renowned ENT specialist who treats sleep apnea and other sleep disorders. He has vast experience and a wealth of insights to share with us. Dr. Pang has also revolutionized treatments for sleep disorders, and his work with young children and adults alike has made significant breakthroughs in the field. I urge you to save, bookmark, and favorite this episode. Better still, share this with all you love and care about. All right, let's get going. Hi, Dr. Pang. Thank you so much for coming on the show.
Thank you for having me.
I have to tell you something. Just before the sleep episode we're doing today, I couldn't sleep last night. I had so much trouble falling asleep. And I know it's a little bit of anxiety that I was having.
Mhm.
And my brain was just fired up. So, yeah. Well, tell me, is there an ideal time that we should go to bed?
Definitely. In fact, because of sleep physiology, for most of us, the melatonin levels, which is a sleep hormone that's released in the brain from the pineal gland, is released about 11 p.m. So the melatonin comes out at about 11 p.m. So you feel sleepy by about midnight, and then it starts to peak at about 1 a.m. and starts to dwindle after that. So for most of us, you don't feel sleepy anymore after about 3 to 4 a.m. Therefore, we must catch this melatonin peak. So it's advisable to sleep between 11 p.m. to about 7 a.m. every day.
Okay.
And a lot of us, either they burn a midnight oil or they're on social media or they're working overtime. And by the time you cross that 1, 2 a.m. mark, you're not sleepy anymore. And you find that you just can't go to bed. So a lot of teenagers as well, they all have this, delayed sleep phase syndrome, which means they actually sleep later and later at night. So they miss this melatonin peak. So they find that when they start to go into the working world and they start to work, they find that because next morning they have to wake up at like 7 a.m., they find that they can't fall asleep at midnight anymore because of this delayed sleep phase syndrome that they have. So a lot of times we need to teach them some sleep hygiene. Sleep hygiene is something that we need to follow for most of us at least. Number one, to sleep regularly on time from 11 p.m. to 7 a.m. every day. And no caffeine after 2 p.m. if possible. And the room needs to be very dark, cool, and quiet. No important discussions like 4 hours before sleep, That means don't discuss your profit and loss for the previous year, or don't discuss the children's futures just before you fall asleep.
Okay.
And 2 hours before sleep, you should avoid blue light. Therefore, if you're planning to sleep at like midnight, by 10 p.m., you should wind down. No iPhone, iPad, television, laptops, no social media if possible, and try to read a book. For most of us, we should read a book with a yellow dim light next to us, and preferably next to your bed, not in bed itself, because the bed is strictly for sleep only.
Can I just ask, this
course.
yellow dim light,
Yes.
it's not bad for your eyesight?
No.
What is it?
Okay. Actually, for those with sleep problems, because the white light has blue light in it and it stimulates the brain, studies
Right.
have shown that people who are a bit more anxious with anxieties, their neurons fire very fast. So with the blue light, they get very tense and anxious, especially if they are stressed out about the next day's program or the next day's work, and then they cannot fall asleep. So they keep thinking about what I need to do tomorrow. And those with a to-do list, they tend to be very what Chinese call kanchong about things. So they tend to be very anxious. And a lot of them are perfectionists as well. They must check off the check boxes.
I feel like you're talking about me.
It's very common in Singapore. That's why we are one of the most sleepless societies in the world, actually.
Oh, we are.
Yes.
Okay. Tell me more about this being a sleepless society.
So, studies have shown, especially in Singapore, we find that a lot of people, because of their work schedules and because of their deadlines and all, they tend to sleep later and later, and they take sleep for granted. You know, the average Singaporean lives about 85 to 88 years old. That's our lifespan. And we sleep about 6 to 8 hours a day. So that's 1/3 the day, you know. So we spend 1/3 of our life sleeping. So if our lifespan is about 85 to 88 years, you can imagine we spend about 26 to 27 years of our life sleeping. So we spend so much time sleeping, and yet we take it for granted. Most of us think that, you know, tonight we're just going to switch off the light, my brain will switch off, and I'll fall asleep. It's not true, because a lot of people have this condition called insomnia. And we like to use the word sleeplessness because insomnia has a very bad stigma to it. It's as if, you know, I'm never going to fall asleep again. So we like to use the word sleeplessness instead. So a lot of these patients actually, occasionally, especially during a stressful period of their life, they tend to not be able to sleep. Then when they go on a holiday, they sleep better. So this is very common in my practice because I run a sleep center. So I see two ends of the spectrum. At one end, I see patients who say, "Doc, I'm so tired, but I can't fall asleep." These are your insomniacs. At the other end of the spectrum, I see people who say, "Doc, I sleep like 10 hours. I can't keep awake. I'm always so sleepy." These are patients with sleep apnea. And sleep apnea is
right.
another topic. Those patients who actually snore and actually stop breathing at night.
Which we will go into later on.
That's right.
Okay. So is the 8-hour sleep rule the best for everyone?
Okay, very good question. You know, we all have different sleeping requirements, so to speak, depending on our work schedule, depending on our personality as well. But I want to say that if I may take you back a few more steps backwards. Sleep physiology is very important because there are two main types of sleep. You have the non-dream sleep and the dream sleep. The dream sleep has been shown to be the most important sleep throughout the whole night. It's also known as rapid eye movements. That's when actually studies have shown that the eyes actually dart from left to right when you're dreaming. And that's why the term rapid eye movements. And for example, if a person were to sleep about 7 hours, we spend about 25 to 30% of the night in dream sleep. And studies have shown that the more you dream, the more refreshed you are. And I have a lot of patients that come to tell me, "Hey doc, you know, last night I dreamt I was chased by a dog. I ran and ran. I woke up this morning very tired, you know." But that's not true, because no matter what forms of dream sleep you have, they are good actually. But of course, those patients who have frequent nightmares and they wake up a lot, it causes what we call sleep fragmentation. So when they wake up the next day, because of the sleep fragmentation, they tend to be a little bit more tired. But these are patients with a little bit more emotional, perhaps disorders or emotional stress. Yeah, these are patients who get frequent nightmares. But in general, it suffices to say that the more you dream, the more refreshed you are.
Is it possible to sleep without dreaming?
Good question. Actually, no.
Huh?
Yeah, almost all human beings dream at some stage of their sleep. Yeah, therefore, depending on the percentage and quantity, but we all actually dream. There are some drugs that actually deprive the brain of dream sleep. For example, if I may say, the benzodiazepines, they are actually some sleeping pills. And therefore, you know how some patients who say that, hey, doc, I'm on sleeping pills because I don't sleep well.
Mm.
And I find that the sleeping pills make me more tired. There are two main reasons. One of them is because of the hangover effect. Maybe some sleeping pills have a longer half life,
Mm.
and the next morning they wake up still tired. But the other reason is because these benzodiazepines, they actually deprive the brain of dream sleep. So, can you imagine if you don't dream at night, you wake up very tired the next morning? So, it so called contradicts why somebody would want to take sleeping pills to fall asleep, and yet he wakes up more sleep deprived. So he's
Okay.
more tired when he wakes up.
So to clarify, it's when people say that, I was dreaming so much that I wake up feeling tired, it's actually not the dreams that is making them tired, but rather that interruption that they were
Uh,
experiencing throughout
Good
the
question.
night.
That depends whether they have sleep fragmentation or not.
Right.
Yeah, but we don't remember our dreams, right?
Yeah.
On average, a human may dream about at least maybe 5 to 10 different dreams a night, or even more.
Okay.
And you only wake up when you dream of nightmares because it's disturbing. You know
Right.
how it is when sometimes you dream, the dream is so real that, for example, if you dream of a bereavement of a loved one, somebody passed away, you can wake up crying sometimes.
Yes.
I've had those dreams as well. And you wake up, you say, oh, thank God, it was a dream. But they're so real. So dreams are really very real to us. And you find that you don't remember your sweet dreams because you sleep through it naturally, right?
Right.
It's the disturbing ones that you wake up and you say, oh my God, I just dreamt of somebody passing away.
Yes.
And you say, thank God it's a dream. But it's very, very real. And these dreams actually makes the person more rejuvenated and more energetic the next morning. However, if I may share with you, that dream sleep is defined as a highly active brain in a paralyzed body. Why do I say that?
Wow.
Okay, because when you're dreaming, if you dream you're playing basketball or soccer, you don't actually kick your spouse, right? Because your muscles are all paralyzed. So you'll be dreaming, your brain is very active, but your muscles are paralyzed. So this is God made us in perfection. That means that we can dream as much as we want, whether or not we're in a boxing ring fighting, our body is paralyzed. But this works against the person with sleep apnea. Sleep apnea is a person who snores and who stops breathing at night. The reason being, for example, when the body is paralyzed because of a dream sleep, the muscles in the upper airway start to collapse. So these patients actually snore, then they go something like, but
Yep.
suddenly when the airway starts to close because they're dreaming, the airway closes, they go like, then suddenly they wake up because the airway closes and they don't breathe. And when you don't breathe, your oxygen is low, your heart pumps faster, your blood pressure goes up, the brain is very disturbed. So that's what happens in a patient with snoring and sleep apnea.
Does it mean that if you snore, you have sleep apnea?
Good question. I want to say that, let's say you take 10 people with snoring, about half of them have sleep apnea, yes. But usually the bed partner or the spouse knows that, my bed partner is snoring and he looks as if he's choking. So this works against the patient himself because he wakes up more tired. Because every night, can you imagine that you need to get restful sleep, right? And every night when you fall asleep, then you start to dream. And dream state is defined as a highly active brain in a paralyzed body. So when it's time to dream, the body is paralyzed, the muscles in the upper airway starts to collapse and close up. So this patient with snoring or sleep apnea, he actually cannot dream. So if he cannot dream at night, he wakes up very tired. That is why all my patients with snoring and sleep apnea come to tell me, hey doc, you know what? I slept 10 hours, but I'm really very tired. I cannot focus during the day. I cannot focus during a meeting. I fall asleep. My boss gets upset. In fact, I drive, and some of them say when I drive, I even almost get into an accident. So it's actually quite dangerous. So going back to your question about 8 hours sleep, the duration of sleep depends on the age of the patient himself. Like, for example, newborns sleep about 18 to 20 hours per day, which is a good thing. So the parents get some respite and rest. And infant will probably sleep about maybe 16 to 18 hours, and then a toddler about 12 to 14 hours. And as the child grows up, they sleep lesser and lesser. And I would say that, for example, a teenager, he's supposed to sleep between 8 to 9 hours, but of course, that's not possible because of the advent of social media and the mobile phones. For adults, at least, we should sleep about 7 to 8 hours. And even then, sometimes it's not possible because of our work schedule. Like for myself, I send my children to school in the morning. I wake up about 6 a.m. I sleep by 11 every night strictly, and we don't discuss any sort of important discussions before sleep. So that we can at least wind down and sleep better. And I wake up at 6 a.m. every morning. So I'm pretty tired. I do catch an afternoon nap, which is called a power nap, right?
Okay, I want to
Yeah.
ask you all about it later on as well,
Yes,
this nap
that's
thing.
right. So I play sleep catch up because we incur a sleep debt over the weekdays. So you're allowed to play sleep catch up. For example, on a weekend, if you don't send your children to school, you're allowed to wake up at maybe 7:30 a.m. Yeah, and
So,
in the afternoon, you might actually take an afternoon nap. Yeah.
so then, should you sleep till what we call 自然醒, or should you sort of set the alarm?
Right. Okay. The problem with this 自然醒, sorry, my Mandarin is yeah.
Which means for
You wake
the
up
context of
yourself.
our listeners is you wake up naturally. You
Right.
don't have an alarm. You just sort of wake up.
It's good if you really have no work to do, but in Singapore, it's quite rare. And sometimes it breeds complacency because you think that, next morning I can wake up at 10 a.m. So I'm going to sleep at 2 or 3 a.m. at night, So it's not a good idea.
Okay.
I want to say that sleep hygiene should be followed strictly. 11 to 7 is the magic number. That's what I tell all my patients. And
Even when you travel?
oh, of course, traveling is different because there's jet lag. Right? Yeah,
Yes.
that's a different topic in itself. But I want to say that depending on how long you travel, because if you're going to go just for 3 days, you must as well stick to your local time rather than going overseas and trying to overcome jet lag.
Oh.
Yes. And jet lag depends on not the duration of travel, but the direction, right? Because if you travel up north, you're still in the same time zone, or south for that matter. But if you travel east or west, you're going to change time zones, right?
Yes.
Yeah. So direction of travel is more important than duration of travel for jet lag. Okay. So as I was saying, taking afternoon nap is actually important, but don't take more than about 30 to 45 minutes because then you start the sleep cycle all over again and you wake up more tired. It's called sleep inertia. So I want to say that if you can take a cat nap or power nap in the afternoon, about maybe 20 minutes to 30 minutes maximum.
Okay, let's come back to the nap later. I wanted to ask you because you talk about having to sleep at 11 and then wake up at 7.
Yeah.
But there are people, who miss that time and they say, but I can still sleep and I can still wake up and I can still function. So what's the problem?
Perfect.
What are some of the problems
Yes.
that we don't know that we might have? I mean, in the
future.
long term, like the long-term consequences of having poor sleep hygiene.
Very good question. In fact, my patients would tell me that, doc, I sleep at 3 a.m., I wake up at 10 a.m. every morning, but I'm okay, These are usually the younger ones. When you hit my age, like 50 plus, you start to realize that, you start to pay for your sins when you were young. It's called the folly of youth,
Okay.
You tend to take sleep for granted. That's the problem.
So what happens?
Okay.
What do you mean?
A lot of these patients who sleep very late at night, they have developed this thing called delayed sleep phase syndrome, as I alluded to. And because of that, when touch wood, but if there's any bereavement or any stressful periods of their life and they cannot cope, they start to, think too much. And because of the emotional disruption or stress or pressure, they start to develop insomnia and they can't fall asleep at all. Yeah. And especially if they change jobs and there's a new job that requires them to wake up at 7 a.m. So therefore, they can't fall asleep at midnight because they're used to falling asleep at 3 or 4 a.m. So they fall asleep at 3, 4 a.m., but they need to wake up by 6 to get to work by 7. So they only sleep 2, 3 hours a day. That makes them very tired. Yeah, and that affects their mood, affects their work productivity as well.
Any other things that could happen?
You see, the key thing about insomnia is the 3 Ps, we call it, which is the predisposing cause, the precipitating cause, and the perpetuating cause. The predisposing cause is usually personality. So studies have shown that patients who are a little bit more anxious type, perfectionists, those who has a to-do list, those who are a bit more kanchong than other people, they tend to sleep later. They tend to think about tomorrow's
Work.
program,
Mm-hmm.
tomorrow's work. Yes. So these are the predisposing causes, and a precipitating cause is usually maybe a bereavement, loss in job, marital issues, emotional trauma, and then they develop this so-called severe sleeplessness. And then there's always a perpetuating cause. For example, because they're tired in the day, they drink a lot of coffee, and you know caffeine is bad for sleep. So they drink a lot of caffeine, and then that makes things worse. Or at night, they are busy looking at social media, they're very stressed. They're trying to catch up with friends because they're working too hard. And then that affects their sleep as well.
Some people drink wine and some people take supplements. Is that okay?
Supplements are okay. I mean, I got a lot of patients who actually take melatonin, which is okay. I do encourage patients with sleep problems to take melatonin and magnesium as well. Some go for the valerian, which is actually all herbal supplements, which is fine. Actually, I have no, I'm not against it. But alcohol is different because alcohol paralyzes the muscles. So patients who actually snore or have sleep apnea, it makes it worse. So patients who have sleep apnea or snoring, it makes their airway narrower and more collapsible, and therefore the oxygen level is even lower. So I cannot say yes to alcohol.
Okay. So maybe you can help our listeners, sum it up. How can you build a good sleep habit?
I want to say that in general is just having good sleep hygiene and not taking sleep for granted. For example, like sleeping regularly, 11 to 7 every night. Keep a good exercise regime. That means try to exercise daily if possible. 30 minutes cardio exercise, not just lifting weights, and do it if possible before sundown. Outside is the best because the benefits of running in a park or a park connector. And then, of course, no exercise 4 hours before sleep. So if you have to sleep by 11, please exercise before 7 p.m. And then no white light, which means mobile devices or laptops or computers, 2 hours before sleep. Avoid alcohol and smoking. And of course, no caffeine after 2 p.m. if possible.
That's very good tips. We go back into the sleep disorders, some of it that you were talking about. So one of it is the sleep apnea. Is there
Yes.
any other sleep disorders that we should know about?
Okay. Well, in general, sleep disorders are wide, varied range. There are more than 40 different international classification of disease of sleep disorders
Are there any
itself.
common ones that you see patients for?
The two commonest ones would be sleeplessness and sleep apnea.
Okay.
Yeah, and of course, I do see the in-betweens, which is, for example, the sleep paralysis,
Oh,
sleepwalking,
what is that?
teeth grinding,
Oh,
things like that. Yes, even bedwetting.
okay.
Yeah. We can start off with sleep paralysis, for example. Sleep paralysis per se is not a sleep disorder. It is one of the signs that sleep and wakefulness is not mutually exclusive. Why do I say that? Okay. It means that, for example, dream sleep. I alluded to dream sleep, the definition being a highly active brain in a paralyzed body.
Uh-huh.
Okay, so you imagine you're now dreaming. So you're dreaming, and then your muscles are paralyzed. But suddenly your dream stops, and you open your eyes, you wake up, but your sleep paralysis, or rather your muscle paralysis, is ongoing. So this is called sleep paralysis. It does happen. It is not a disorder in the sense that it's more of a phenomenon. I've had it before. Some of these patients actually say that they feel like something is compressing their chest.
So that's the superstition of the ghost and something like the
Yes,
spirits and all
be.
that.
It could be. Yes, it could be. I felt it before. And some of these patients actually have sleep paralysis for like 30 seconds to 1 minute. And that can be a very long time if you totally cannot move with your eyes open, right? Yeah. So
And you're aware.
you're totally aware
Oh,
of the surroundings. Yes.
okay.
That's why a lot of, like you said, superstition think that it's like a ghost in the room.
Yes,
Yeah.
and it can be quite scary.
It is.
What should someone do about it if they discover themselves waking up and stuck?
Well, first of all, it's not a disorder. It's a common phenomenon actually,
Oh,
and you may never experience it again. But I do have patients who have it over and over again, and usually these are patients who are sleep deprived, either and maybe overtly stressed by some psychological or emotional injury, and these are patients who take sleep very for granted, and they sleep irregularly. So I get them to switch to good sleep hygiene, healthy lifestyle, and many of them actually overcome it.
but I
and don't
suppose
have it.
that
Yeah.
moment when you wake up and you realize you can't move, don't panic. right?
Yes. Even if you panic, there's nothing much that you can panic about because you
Oh,
can't move.
right.
Yeah. So
Okay.
after you overcome the paralysis and you wake up, then you like, phew, yeah. Then I better check on internet. What am I suffering from? Most
Okay.
of them do that. Yeah. And Dr. Google gives them the full classification of what's wrong with them. Yeah.
So
Yeah.
it's actually building good sleep hygiene actually
That's right.
for that. And then the
Yes.
second one is
Sleepwalking.
sleep.
So
Oh.
yeah, okay. I want to share with you that sleepwalking is genetic. So it's pretty common. I see that a lot, and the onset of age is usually in childhood,
Mm-hmm.
maybe between 5 to 7 years old, and in children usually. It's a different stressful period of their life. For example, maybe they change school, or
Mm.
maybe they get bullied in school, or they're suffering from some form of emotional stress in school, preschool, or what, something that they're not used to, or maybe there is any marital issues in the
Mm.
family, and usually they grow out of it, lah. Yeah, and the issue is those children who actually don't grow out of it. And I do see many patients with sleepwalking in adulthood. And I will share with them that there are three things that they need to be very careful about. Number one, they must never take alcohol because it's been shown to make sleepwalking much worse. Number two, they must never be sleep deprived because it's been shown to make sleepwalking much worse. And of course, stress, which is difficult to manage,
Mm.
but I think that if you have a very good mental ability to remember to avoid stressful situations, or learn how to ventilate, like talk to someone or do exercise regularly, get outside rather than be cooped up in a small box all the time, it really helps lah. So in fact, if you Google sleepwalking and murder, there are a handful of cases in the world where a sleepwalker actually commits a crime without even knowing that he did it. Yeah, so sleepwalking can be dangerous potentially. So I tell all my patients to be very, very circumspect and careful about it. And the other one is night terrors that I see.
Oh, with young kids.
You heard about night terrors?
I've heard about it.
Yes.
Tell us a little bit more because
So
I don't have experience with it.
right. Actually, my brother had night terrors. So my younger brother. So I kind of grew up watching my brother looking like in a frenzy, when he was about 5 years old at that time. So usually age onset is about 4 to 5, and they grow out of it typically by 7 or 8.
Mm.
Yeah, and they wake up in a frenzy. Their eyes are like open, but they look like in a panic, like as if somebody is chasing them. They do not know what to do. And the idea is to calm them and walk them back to the bed or try to calm them. Sometimes they refuse to get back to bed, but the idea is not to scold them or to beat them, but to bring them back to bed, calm them, and let them fall asleep again. Yeah, and they
That is
usually go out of
different.
it.
That is different from nightmares.
Oh,
Night
totally
terror.
different, because nightmares, typically the patient himself or the child can remember.
Right.
Night terrors is something that they totally cannot remember. They will not even remember what happened, although everybody else in the house is in a panic. But
So is that because they are watching too many cartoons or reading
good
horror
question.
stories,
Well,
or
there is
what
no
is it that we
scientific
can?
basis. Anecdotally, maybe, but we believe that it occurs in stage 4 sleep. That means just before dream sleep. So usually typically, right, these patients with night terrors, they have their night terror episode just before the first dream sleep occurs, which is typically 90 minutes, 60 to 90 minutes after they fall asleep. So I teach the parents to wake the child 60 minutes to 90 minutes right after he falls asleep. For example, if a child goes to bed at 10, typically he will have his night terrors about 11:30 or midnight. And the parents always say it's always at the same time. I say, yeah,
Okay.
we know that. So the parent will have to wake the child up and not just push him, wake him up physically, walk to the toilet and pass urine kind of thing, go and pee, so that the child is fully awake to break the cycle. Then go back to sleep. You find that at night there will be no more night terrors.
Oh.
Yeah, so they try to do that, for about a month or so. Then you find that the child overcomes it. So the next sleep disorder will be bruxism. Bruxism is teeth grinding. And teeth grinding is something very, very common in children. I used to teeth grind as well. And, in the old days, dentists used to think that teeth grinding is when the patient sleeps at night, and then his upper and lower jaw starts to have a lot of lateral movement. Lateral meaning side to side movement, and they sound very like as if they are crunching on something very hard, but it's actually their own teeth. And the dentist used to think that was due to malocclusion. Malocclusion means that, for example, one of the tooth is not aligned with the rest. We take our bite, B-I-T-E, our bite for granted. Like, for example, I'm just biting on my teeth right now. We take it for granted. But can you imagine if you have one tooth that's sticking out, your bite will be off. And that is very, very uncomfortable. But because all our life we've been eating and just chewing on food, we never think about our bite. But the bite is very, very important. So in the old days, the dentist used to think that teeth grinding is because one of the tooth is misaligned. So the body naturally tries to grind it down at night when they are sleeping, you see. But that's not true, because we know now that, number one, teeth grinding is genetic. And the onset of this teeth grinding is usually between 5 to 6 years old. And they usually grow out of it by about 11 or 12. Some people never, and they still grind until today. But however, studies have shown nowadays, scientific research has shown, especially study of the upper airway, which is the breathing patterns, has shown that this teeth grinding is actually due to a collapse of the airway. Okay, let me explain to you. For example, if I'm breathing right now, you notice my neck doesn't collapse. But if I were to have a blocked nose, for example, watch my neck. Can you see my neck collapsing? Can you see it? Collapsing inwards.
Okay.
So instinctively, if I am sleeping right now, but if I have a blocked nose and if my airway is collapsing like that, because I need to suck air into my lungs, right? I create a lot of negative pressure here. My airway starts to collapse. Instinctively, I do this. Watch. I bite down to keep my airway open. So these poor children and adults, they actually have a nasal pathology, which means nose block. So if they have a nose block, in order to breathe air in, I need to create a negative pressure in my lungs in order to suck air in. But then because of my nose block, I'm doing this. Every time I suck air in, my airway collapses. I bite down to keep my airway open. And that's teeth grinding.
Right.
Yes.
Okay.
And for our children, if I may just elaborate further.
Yes, please.
The first 7 years of a child's life is called the neuroplasticity. That means the brain. Neuro is brain. Plasticity is like stretch, okay? So the first 7 years, studies have shown that it's the child's neuroplasticity. That means, you know how you learn a language. For example, if you grow up in a Chinese family, you just naturally speak Mandarin, right? If you grow up in an English family, your English becomes stronger. So studies have shown that actually, in the first 7 years of your life, a child can imbibe language so quickly that they can learn like 4 or 5 languages if they're exposed to it in that first 7 years of their life. So it's amazing. And that's the most important so-called development of the brain, the first 7 years of their life. And these are the children with teeth grinding, blocked noses, they don't breathe well, and children who snore, who don't get enough oxygen at night, who have sleep apnea. These are the children who don't develop properly in their brains. So I see a lot of children as well. In fact, 1/3 of my practice is children. And I see a lot of parents that come in to say, hey doc, my child snores, He looks as if he can't breathe at night. He's choking. He sleeps with his head extended, his mouth open, and he does this.
Ayo. It sounds very dangerous.
It is dangerous. And I see parents, right? They're so worried. They say, doc, my child cannot breathe at night. Yeah. And when you examine them, they either have big sinus swelling, sinus turbinates are swollen, big adenoids, big tonsils, that after treatment, right? I have parents that after treatment, after surgery, they come back and they cry, They say, doc, this is the first night of my child's life that he can sleep peacefully without any snoring and without choking. It's amazing. It's like day and night. Literally, it's transformative.
So many gems in this episode. If you're enjoying it so far, please like this video on YouTube and give us a 5-star rating on Spotify. We would really, really appreciate it. Your feedback helps us produce even better content for future episodes, and your support means the world to us. Okay, now back to the episode. So let's talk a little bit. So we covered the disorders, right? So let's talk a little bit about like treatments.
Yes.
For example, for all the various disorders that you've seen commonly.
So usually what happens is that 2/3 of my practice, I see adults. So these adults are usually male who are snorers. And these snorers usually are within the age of 20 to about 60. And typically all of them come in to say, you know what, doc, my wife says I snore badly. I keep her up at night, but it doesn't bother me, it bothers her. So a lot of men are not aware that they have sleep apnea. They know that they snore. They know that it affects their wives in terms of sound, but they are not really bothered by it. So, and I usually ask them the symptoms. So the symptoms of sleep apnea at night, for example, is loud snoring. If the bed partner or the spouse notice that the patient himself chokes at night, or he wakes up a lot, very restless, tossing and turning. It's as if he's trying to find a good position to sleep, but he can't. Or if he wakes up to pass urine a lot, it's called nocturia. So typically they wake up a lot to pass urine. Why? Okay. Can you imagine if every night I can't breathe? I'm trying to suck air in through my lungs, but my airway is close. So my diaphragm pushes on my stomach pushes on my bladder. I keep wanting to pee. So these patients, they wake up to pee 4-5 times a night and they don't even know why. They think that they got some urological problem or bladder problem, but it's actually due to sleep apnea. And during the day, they are very moody, they are short-tempered, they're very edgy, and they are tired, and they can't focus. They have very short-term memory loss. They can't remember what they were saying. Brain fog is one of them. I see a lot of patients who say, hey doc, I've got this brain fog. It's as if I say something and then later on, what was I saying just now? They just cannot remember. So these are the symptoms of sleep apnea. So typically when they come in, I will examine them because the problem is with the airway. Our airway is between the box, which is the jaw, and the contents, okay? It's like a tissue box. When you have a big tissue box, you can put a lot of tissue paper in it. But if you have a small tissue box, you cannot put much tissue paper, okay? So can you imagine patients with a small box? For example, what's a box? Okay, my jaw. Can you see I have a square face? So my jaw is quite big. There are patients with a very nice heart-shaped face. So their jaw tends to taper down, so their mouth is very narrow. And some patients have a big tongue as well, okay? So what happens is that if I have a big jaw, my airway is bigger. If I have a narrow jaw, my airway is smaller in that sense. So the jaw and the airway is all interdependent. That's what I'm trying to say. And the inner tissues are very important. For example, the sinus turbinates, the adenoids, the palate, the tongue, and the tonsils all occupy space. So usually when the patient comes in to see me in the clinic, I will examine them. I do a flexible endoscopy, which is basically just looking into their nose and their mouth to see what are the structures that I may be able to improve with surgery. For children especially, because you know how it is when you use something, that part of the organ actually grows bigger. For example, when you go to the gym, you exercise one hand. These muscles here hypertrophy, which means it grows bigger. If you don't exercise your left side actually gets smaller. So the same for children, You know how our function affects our form, meaning that if we use something a lot, that part of the body grows bigger. For example, children with blocked noses, children, they always have these sinus problems. In the mornings, they're like, they're always sniffy, and then they achoo, or they got blocked nose. A lot of these children have nose block. So because they have nose block, they can't breathe through their nose. They tend to drop their jaw and breathe through their mouth. So what happens is that they open their mouth, and then because they open their mouth, the lower lip gets thicker because they're always doing this every day. And because they don't use their nose, their mid-face becomes flattened. They don't use their nose becomes smaller. So they become like that, with a facial shape or like that. We call it a spoon-shaped face. That means the mid-face, if you look at the side profile, the mid-face becomes backwards and the lower jaw grows this way.
Can that be rectified?
Yes. So I tend to be very aggressive with my children, the patients that I see, because we don't want them to develop into some form of craniofacial structural abnormality because it affects them long term. So what I do is I make sure I clear their nose, meaning that make sure that they can breathe properly so that children learn how to close their mouth and breathe through their nose because God gave us our noses to breathe through our nose.
You said that there may be long-term consequences with the cranial.
Craniofacial structure.
Yeah. What are the long-term
Well,
consequences?
one of them is cosmetically, they don't look pretty or good looking because they get this, what we call prognatism, with a very big jaw. You know how it is when cartoon characters, they tend to draw the villains with a big jaw because they look aggressive, like Green Goblin in Spider-Man. So we don't want them to look like that. So in general, they need to have better craniofacial growth and craniofacial structure. And of course, long term, because they are nose blocked, chronic nasal obstruction, they don't get enough oxygen in their brain. So it affects their breathing, affects their neuroplasticity development of their brain, affects the academic performance. And this is all related to attention deficit hyperactivity disorder.
Mm.
So after that, I put them for a sleep test. So the sleep test is a diagnostic device that actually monitors overnight. There are two main types. One is the patient needs to stay in a hospital where he's given all the wires and all. He sleeps one night in hospital and we monitored his breathing, his oxygen, his heart, his lungs, his brain to see whether he goes into dream sleep and whether or not he actually stops breathing, how many times, how low is the oxygen and how dangerous. Because we know for a fact that a normal person stops breathing about 5 times per hour. Yes, normal people do.
Oh.
Yes. However, severe patients stop breathing about more than 30 times per hour. And I have seen patients who stop breathing 100 times per hour. It's really scary.
So 5 times is okay.
5 times is fine.
All
Less than
right.
5.
The 100
yes.
times. Okay.
Yes, so I do see patients who stop breathing like 500 times per night. And that's classified under severe sleep apnea. Your question to me is, so what's the consequence of that? The medical consequence is obviously hypertension because when they stop breathing, the oxygen is low, their heart pumps faster, the blood pressure goes up. So these patients all have high blood pressure, which is hypertension. They may develop ischemic heart disease, which is coronary artery disease, strokes or heart attacks as well, other than like sudden death at night. In fact, I've seen a lot of cases where the poor patient suffered a stroke just because he was a bad snorer and he never went for any forms of treatment. Yeah, so this can be quite sad for the patient.
I feel like it's totally preventable.
Thank you very much. Yes, it is.
Yeah, so you were saying about the sleep test. One is in the hospital.
And the other one is home. Yes. So my patients actually bring a device home.
Oh, show me.
Yes. So basically they wear this device. It's called a watch pad. PAT being peripheral arterial tonometry. They basically wear this watch on and it's very simple. And with this little probe onto their finger itself, just pretty much like that. So they just put it on one night. And it actually measures their oxygen level, their breathing, including whether or not they have any forms of
And the
dream
other
sleep.
wire goes.
The other wire goes onto the chest.
Oh, right.
Because this measures sound, as in the snoring.
I feel like wearing this is quite stressful, Like, will it,
Yes.
like wear this and I can't sleep because I know that I'm like taking a test and then like.
Absolutely, but you're different because patients with sleep apnea are very tired. So they fall asleep anywhere. So for them, no problem because they'll fall asleep anywhere anyway. Yes.
Okay, so this is to test all that you mentioned just now.
Absolutely. So this is the home-based device that actually measures the oxygen level, the heart, the lungs, the brain, whether or not they actually stop breathing, how many times and how dangerous. So after this sleep test, what I do is I actually talk to them, explain to them the results, and then we can decide from there what is the next step that we want to take in terms of treatment options. Because, for example, I tell all my patients to keep a healthy lifestyle, to lose weight, and to exercise regularly, avoid alcohol and, of course, smoking, and very good sleep hygiene. Sleep habits are the most important. And then comes the real medical treatment, which is obviously there are 3 main types. One of them is a mask that they can wear at night. And this is actually a mask that they put on with nice straps over the forehead as well as the chin. And this is connected to a machine. This machine is like a reverse vacuum cleaner in the sense that every time the patient stops breathing, this machine will detect it and will blow air into the face. So it kind of like a pneumatic splint. That's what we call it. That means to say that it blows air to keep the airway open. So this is what happens. So every night, every time the patient snores or he stops breathing, the machine will blow air into his face. So this
I'm sure this
helps.
is not a very popular option because it's quite
Very good.
cumbersome, isn't it?
Yes, it's cumbersome, but it works, But it is
It
not
doesn't solve the problem, I think.
brilliant. Yes, it doesn't solve it. So it's not a cure, it's a control. So the very night that the patient doesn't wear it, he goes back to his old self of choking at night. Yes. So this must be worn every night and for the full duration of sleep if possible.
And that
Yes.
machine that it connects to, is it like a big machine?
Good question. There are different sizes. There are portable ones as well for
Right.
patients who travel a lot, right? Because my
Yes.
patients are jet setters as well, so they travel a lot. So yes, this is one of them, which is called the CPAP. Continuous positive airway pressure. So it actually works. So if the patient can tolerate it, he should wear it. Yes. The next treatment is actually an oral device. So this is an oral device. It's pretty much like a denture. However, it holds the jaw forward. So patients need to wear this denture every night. It's custom prefabricated and custom made to the patient's bite, obviously, because we all have different teeth. So basically what it does is that it holds the lower jaw forward like that in order to expand the space in the mouth behind the tongue.
But it'll make me ugly.
Only at night.
Oh.
Yes, daytime you'll go back to your.
Because it reminds me of like
self.
retainers, right? When you wear
Yes.
retainers, it's to sort of make your teeth straight and all that.
Yes.
If this thing makes your mouth like
Yes.
that, then
Yes.
I'm gonna have an ugly
Well,
jaw.
Aesthetics aside, it is not meant to stay like that the whole day because after you wear it during the day, your jaw goes back in place.
Right.
However, some patients have jaw aches because stretching a ligament and muscle, your jaw joint, sometimes it can hurt as well.
This is to
Yeah.
prevent grinding. Or
Yes, not only grinding, but it expands the airway space behind the tongue.
again, also
Yes.
not a sort of like, it's a control.
It's a control. You need to wear it like all the
Oh,
time.
yeah.
Yes. And the third option, which is the last option, usually is surgery. I say that because surgery is not reversible. You cannot undergo surgery and say, Doc, I changed my mind because it's done. So in general, I usually operate on the nose as well as the mouth. I invented a surgery. It's known as Punk's expansion pharyngoplasty. 17 years ago in US when I was there. And I must say I'm very encouraged because I went around the world to teach. And I didn't patent it because I wanted to go around the world to teach so that more people can benefit and so that I'm not the only one who can do the surgery and I teach other ENT surgeons. And I've taught at least 3,000 to 4,000 ENT surgeons already. And right now, after the data has been published in the international peer-reviewed journals, I did a meta-analysis, meaning that I took all the data from other surgeons as well, and I put it together. So I analyzed other journal published scientific papers, and the studies have shown that it is 80 to 85% success rate for sleep apnea itself in terms of cure. And I want to say that that's very encouraging, meaning that this procedure, the expansion sphincter pharyngoplasty, is not only successful in my hands, but I can replicate it and teach it to other surgeons so that they can help their patients as well. So I'm very encouraged to say that this surgery actually works and benefits patients with sleep apnea.
So what does it do?
Basically, what I do is like I rotate some muscles within the mouth itself. So in the oral cavity, what I do is I rotate the side wall muscles upwards superiorly, and then I just stitch it up to hold it up, pretty much like a curtain, if I may. So that it holds up the muscles higher, so that the muscles don't collapse during sleep itself. Yeah.
Are there any other types of surgery to cure sleep apnea?
Because the upper airway is like an air conduit, it's to understand airflow dynamics is very important. Therefore, I illustrated that when you breathe through the nose, but it goes into the lungs. So in order to decrease the entire so-called overload of the airway, the negative pressure, you need to open up the entire air conduit, which starts from the nose to the throat, to the tongue as well, and then into the lungs itself. So it's very important to treat the entire upper airway as a continuum, like an airway conduit. So that's what we do. So I do surgery for the nose as well, to the adenoids, to the septum if it's deviated, to the tonsils, to the palate, and sometimes to the tongue as well. Yeah, I don't cut tongues, don't worry. I don't cut them off. I basically reduce them if necessary. Yeah, the base of tongue. Yeah, we won't go into it, but
Okay.
yeah.
So why would someone, for example, with these disorders be, well, sort of resistant to the idea of surgery, which sounds to me can solve their problems once and for all?
Yes, but because you must understand that surgery is very personal, because some patients are fearful, and after surgery they get a sore throat for about 7 to 10 days. So some patients who have no time, they're too busy with their work, will not have time to do it, as well as some patients who are just afraid of surgery. They will rather something non-invasive, which is the mask or
Okay.
the oral device if they like. Yeah, so it really depends on the patient himself.
So other than the sore throat, are there any other side effects from the surgery?
Pretty much no. It's just that, in life there's no 100%. That's why studies have shown that it's only about 80 to 85% successful, because there will be those 15 to 20% of patients, maybe in about 10 years' time or 15 years' time, they start to gain weight as well. They put on weight again, or maybe they take up smoking, or they discover this thing called whiskey and they like it. Yeah, they drink too much alcohol, and then the whole problem starts again. But after they lose weight, they get back to the ideal weight, the problem may go away again. So
Okay.
internally, the anatomy is very important for me to open up the entire airway conduit. Whereas if they put on weight on the outside, we call it an extrinsic compression. That's when the fat on the outside actually compresses the airway and makes the airway narrow again.
And
Yeah.
it's also the same surgery that is performed on children who have the same
Similar,
problems.
but not completely the same. Yes,
And
similar.
for in children, are there any side effects or
Oh wow.
risks?
I want to say that in children, right, the benefit is outweigh the risk, so to speak, because in children they're resilient, so they don't have this like infection or bleeding. They all is almost less than 1%, and their lives change because their brain development is better and they sleep better, and we find that the academic performance also improves.
Mm.
It's funny that you mentioned children, because there are some research studies that also show that these children with sleep apnea has a high association with ADHD,
Mm.
attention deficit hyperactivity disorder. Because as adults, right, when you don't sleep well, you get very tired and sleepy and moody. Whereas in a child is different. A child reacts differently. That means to say that when they're tired, when they don't get enough sleep, there's this adrenaline overdrive. They get very hyper, so they cannot focus. They touch everything. They sit down 30 seconds, they get up, they run around. They can't focus in class or in school. So this is like ADHD. So there are many studies, pediatric in journals that are published, that show that these children after treatment, after surgery, their ADHD scores drop and they are more attentive, more focused, and in fact, their diagnosis of ADHD is gone.
Mm.
So it's a strong correlation between sleep disorders and ADHD itself.
So with kids, I feel like this is so important for
Yes.
actually not just parents, but school teachers
Yes.
as well to be aware. Because, I mean, I've heard my daughter come home from school before telling me that, oh, I've got a classmate who's always sleeping in class.
Yes.
And I mean, yes, they have to wake up early to go to school, but if a classmate is sleeping in class for the entire year, I don't know, it just doesn't sound
Normal.
normal.
Yes, it is not.
And something must I mean either bad sleeping habits or
Yes.
something else is underlying. So I think
Yeah.
if more of us are aware
Yes.
that there could be possibly this underlying condition that you just shared, that it could solve a lot of problems easier than thinking that it's like they have to be on medication or
Yes.
have to be in a special school because of that condition.
I absolutely agree. That's why having insight into the problem is 50% of the problem solved. Yes.
Mm.
So sometimes parents just need to be aware, and education is very important.
Why is weight loss a solution? Is there a link between weight and sleep?
Many studies have shown that actually a higher BMI, body mass index, is strongly related to sleep apnea. One of them is because of the fat that is deposited in the upper airway, meaning that we know for a fact that the tongue has fat content. Like Wagyu beef. Yeah.
Mhm.
The nicer the Wagyu beef, the higher the marbling, the better it tastes, because there's a lot of fat infiltration. So similarly, the tongue also has fat in it. So the heavier the BMI, body mass index, the more fat the tongue becomes. So the reverse is true. That means if somebody loses weight, his tongue gets smaller.
Oh.
And also what we call the parapharyngeal fat. That means the fat in the neck, So we know that patients with a higher BMI, body mass index, they have higher risk of sleep apnea. And the problem with that is that we know that sleep, right, is related to the appetite hormone as well.
Oh.
It's called ghrelin and leptin. In general, we know that ghrelin is secreted in the stomach cells, the G cells in the stomach, and they make you they're in fine balance between leptin, which is found in the adipose tissue. So we know that patients who have hypoxia, low oxygen at night, they are always hungry because the appetite hormone is high. So you remember those days when you used to study late at night, when you're very sleepy, falling asleep, you can't focus. What do? You reach out for the
Snack.
chips, right? You snack, that's right. So we know that patients, in order to keep awake, they always eat. So can you imagine a patient who is overweight, who has sleep apnea? He's always tired. So what does he do? He starts to eat. And in addition to that, his appetite hormone is high because he has hypoxia or low oxygen at night. So he's always hungry. Therefore, we know that it's very difficult to look at a patient who is obese and say, hey, you better lose weight, because it's not fair. Because physiologically itself, we know that they are hungry because of the appetite hormone. So you can't really blame them in that sense. So these patients who are overweight, you need to give them something that they can grasp, some real so-called therapy to teach them nutritional therapies, or actually nutritional guidelines for them to follow, so that they actually they feel that they're in control of their weight, in control of their life, in control of their diet and appetite as well. So a lot of my patients, after surgery or after treatment, I give them a very strict diet to follow. For example, I tell them to go on a very low carbohydrate diet, especially for dinner. After you eat dinners, you go to sleep, right? So whatever you eat for dinner becomes fat deposited in your body, not just the truncal area, but your neck as well as your tongue. So I teach them how to go on a very low carbohydrate dinners forever. That means they can eat carbs for breakfast and lunch, but they try to go on a very low carbohydrate dinner. So they eat a lot of vegetables, a lot of protein, which is fish, chicken, meat, or whatever they like for dinners, especially. Yeah.
So my question is, right, a lot of what you're sharing with me, on the surface, when we see it, we would not think that it's a problem we want to go and see an ENT specialist for. So I guess, when do we know that we should consult an ENT specialist, for example, when it comes to what doesn't necessarily seem to be related to that?
Very good question. So, usually most of our family doctors, our general practitioners, are already trained in this because it's part of the school curriculum, medical school curriculum, sleep apnea, sleep disorders, ADHD, and things like that. But sometimes it does elude us because we forget, And as long as when a parent or a spouse or bed partner notice that the patient cannot breathe properly, is snoring, is choking at night, or wakes up tired, or very difficult to arouse in the mornings, don't want to get up from bed, or is irritable, hyperactive during the day, forgetful, poor focus, these are signs that point to a sleep disorder. But sometimes we just forget, In us ourselves, sometimes we take things for granted. We take sleep for granted. We hardly think about sleep anyway, right?
Exactly. That's
Yeah.
what I also shared in my introduction. I think from what you're saying, I'm gathering that sometimes when we see all these different problems, maybe look into our sleep first and see whether we are sleeping well, whether we are having good sleep habits, whether we have a good sleep hygiene. And then probably maybe from there we can tell whether or not, it's a problem that we should see an ENT specialist for. Actually, just now when you walked into the studio and you met our producer, I hope I can say this, you immediately said something like, I think you have to come and see me in a couple of years. It's fascinating to me. I mean, obviously you've had a lot of experience. You've seen so many patients, but I mean, it's still a marvel to me that you see someone and you go like, okay, I know. And then you immediately are like, you have this problem, right? And he's like, yeah. So tell me, like, how do you know?
Well, because I've done this for 30 years already, and it's not because when I'm a hammer, so everything looks like a nail, but I'm aware, yeah, just by eyeballing a person, you kind of know whether he has a sleep condition or not, especially sleep apnea, because anybody with a small chin and a bit overweight, they tend to have a very narrow airway, and without knowing, they might snore, and because they are single, they sleep alone, they won't even know that they are snoring loudly or that they stop breathing. But one way they can tell is when they wake up tired, they don't feel refreshed, or even they wake up, or they maybe a family practitioner has told them of health screening notice that he or she has high blood pressure. Yeah, so that's how you tell whether or not. Because in general, most people, when we sleep, our blood pressure drops by 20%. It's called dippers, DIPPER. So we are nocturnal dippers in the sense that when we sleep, our blood pressure drops by 20%. But these patients who snore, typically they have nocturnal hypertension, which means that their blood pressure goes up instead. But it's a paradox because by right, when you sleep, you are supposed to be relaxed. Your blood pressure should drop. But these patients with snoring and sleep apnea, their blood pressure goes up. So this is how we tell that these patients are developing hypertension, and because of sleep apnea, that's how we tell. Yeah.
One of the things that I wanted to consult with you is this, because I used to have this argument with my husband about our children taking naps. So because he's from China, and in their culture, I mean, the children when they go to school, they allocate time for naps in school. Some of them, of course, they go home, but there's a long break in between lunch to the next lesson for them to take a nap. So he's always been about naps and all that. And I used to subscribe to the belief that we should just let the children's body speak for themselves, right? If they feel tired, they should take a nap. But no, he enforces it. He enforces it, and after a while, it's like, okay, I also noticed that some of my children, they can get a little bit, especially if they don't nap. My son, he gets he cranky and all that,
Yes.
at the end. And then for my daughter, she's one of those that I think she can push herself really hard. So she's the one who doesn't want to take any naps. But again, because he said so, and I say, okay lah, let's not fight. And then okay, sleep lah, huh? So then, yeah. And then there's this, I asked my friends, and my friends are telling me that, oh, but isn't a full night's sleep more important? Like if they sleep in the afternoon, they can't sleep at night, or they sleep later, then they're getting less sleep. So what should I do? And I said, yeah, when they sleep at, they try to nap at 3, but maybe they fall asleep at 4. Then that 1 hour is wasted, lying in bed, tossing and turning when they can be doing something else. And then, they end up going to bed at 10. So what should I do about this nap thing? So, all these arguments that we had, right? I want to sort of clarify it with the expert here about children and naps. A lot of parents I know with children my age, 7 and 9, their children are no longer napping. So tell me, what is your professional advice?
I'm a proponent for naps as well. So I'm with your husband on that, in a sense that studies have shown, many published studies have shown that for children, after school, when they go home, they should take at least a half an hour or 45-minute nap, because this consolidates what they have learned in the morning. You'll be surprised because when they are napping, right, their neurons and all, right, are start getting wired, in the sense that when you study something, you need a lot of lateral thinking, because you don't want people to study and regurgitate. You want them to have lateral thinking and to think out of the box, you say creativity as well. And so these children, after full morning day school, when they go back to nap for about half an hour, 45 minutes, they consolidate what they have studied in the morning, especially their memory. And then they wake up and then they go for tuition or whatever classes they have. Then they remember better what they studied in tuition or their classes. So this helps actually. So whether or not they sleep earlier at night, this is a habit as well. So I mandate for myself that all my kids must sleep by 10 latest. So they're in bed by about 9:30 latest, and then they try to sleep by 10 because they wake up at 6 anyway. So they're very tired by 3 p.m. So they give them a half an hour, 45-minute nap, and then they find that they function better as well.
So what should we do if we find ourselves lying in bed and can't go to sleep, like how I was last night?
Basically, to calm yourself, there's a lot of cognitive behavioral therapy. I teach my patients to in your mind as well, especially if your mind is so active, right? Try not to think of thoughts of the future, because future you can change. Like, for example, tomorrow, what do I wear? Or in the meeting, how do I present this topic? Try not to think of the future, because future you can change and try to intervene. I tell my patients to think of the past, and not something that they're regretful of, because then they say like, "Alamak, maybe I should have done this, why, what if this, what if that?" But think of a happy thought of the past, like maybe a nice holiday they had, hiking trip, skiing trip, or water sport trip or whatever. Yeah, think of happy thoughts of the past. That will really help.
I have tried something called Yoga Nidra.
Mhm.
Have you heard of it?
Yes.
I find it very useful
Mhm.
to fall asleep, especially when it's guided. Because
Mhm.
to be honest, I was trying this last night. This do not think, but you see, it's like the pink elephant, right?
Yeah.
Do not think, then you just keep thinking about it,
Yes,
right?
absolutely.
And I was, then from one thing, okay, I don't think about this, but I jump to something else, and like there's just always something for me to think about. So, I find guided, the guided Yoga Nidra practice helps, because then you have someone sort of in your head telling you, relax, take a breath, focus on your breath. And it might be a lot easier to let go of all those thoughts that we are
Yes.
trying to solve.
Absolutely.
So that's my personal tip is, for those who haven't tried, they can try something like a Yoga Nidra, like some sort of a guided
Yes.
sleep meditation.
Yes.
All right, Dr. Pang, there's this trend that's going on TikTok. Apparently, if you tape your mouth, you can sleep better. Tell us, is it a myth? Is it a trend? Or is there some sort of truth to it?
It's a myth. Usually I tell my patients, don't tape your mouth, especially those with sinus problems or sinus allergies, nasal allergies, or a bit of nose block, nose congestion, because mouth opening is actually a survival instinct. You tend to open your mouth when your nose is blocked. So actually it's a good thing for people with nose block. Can you imagine when you're sleeping at night and you have a nose block and you tape your mouth, you pretty much suffocate yourself.
Yeah.
Yeah, so I don't advocate such a behavior or habit or trend, but I want to say that patients who have clear noses, who breathe very well through the nose, and they want to tape their mouth is okay. The reason being, typically, if I were to open my mouth, I can do the palatal flutter, which is called this. This is called palatal flutter. And I describe a sign. It's called Pang sign. Pang is my last name, so it's Pang sign. Basically, I ask my patients to do this. And I tell them to close their mouth now and do it again. You see, I can't do it. Maybe you should try. Maybe you open your mouth
And
a
then?
bit and then do the palatal. Do that. Very good. Now close your mouth tight and do it. See, you can't do it. That's right. So you are Pang sign positive. In fact, I described this sign internationally and I published it in the International Peer Reviewed Journal. And basically what it describes is it tells us that any patient who does this, but when they close their mouth, they can't. It means that if I treat their nose so that they can clear it, as long as they can breathe through their nose, they can tape their mouth, then they can breathe and they will stop snoring. Can you imagine that?
Okay, wait. So you're saying that these are people who are snoring
through their mouth.
through their mouth, but have no sleep apnea, but their nasal is sort of congested somewhat.
Yes, right. Because imagine that if your nose is blocked, you have to open your mouth to breathe, right?
Yes.
Then you start snoring.
Yeah.
Right?
Yeah.
But if I treat the nose, that means if I do laser for the nose or whatever, and then they breathe better, then all they need to do is tape their mouth. They can't snore.
But if they breathe better, they won't snore anyway, whether their mouths are taped or not.
Yes, but these patients who open their mouth, they have blocked noses. It's a survival instinct.
Yeah,
right?
exactly. So actually, all in all, this taping mouth is just unnecessary.
Absolutely. It's not something I encourage or advocate.
Okay, well, thank you so much for joining us today.
Thank you for having me.
I mean, your wealth of insight is so valuable, and I think all of us today have some takeaway, one thing or another that we would find very useful. Before you go, I've got a little gift for you. I usually do this for all my guests, and with your episode, I was like thinking very hard what I should gift you. So thank you so much for joining us. Please open it and see what it is.
Thank you for having me again. You shouldn't have, but it's so sweet. Okay.
It's silk pillowcases.
Oh, marvelous.
Because you're talking about sleep. So I thought, okay, you're the expert. You probably have all, everything sorted out for
Thank
you.
you. Thank you very
So
much.
this one is a gift from me to you, and something you might want to bring on your travels too. Because some people are a little bit concerned about the pillowcases in the hotels.
Thank you.
So I hope this will remind you of your time spent here, sharing your insights and your knowledge on sleep with us.
Thank you for having me.
Thank you so much, Dr.
Thank you.
Kenny. Bye bye. I'd like to thank Dr. Kenny Pang once again for joining us today. As I've personally seen friends and loved ones around me struggle with sleeping disorders, this topic is very, very close to my heart. I'm sure many of you have plenty of takeaways on good sleep hygiene and dealing with sleeping disorders. Please do share this episode with your loved ones or friends whom you think can benefit from hearing Dr. Kenny Pang out. If you'd like to tune in to the next episode and not miss another one, hit the follow button and give us a 5-star rating on Spotify. If you're watching on YouTube, comment your thoughts down below and hit the thumbs up and the subscribe button as well. Thank you, and I'll see you in the next episode of What Do I Know with me, Joanne Pei.